The average number of new COVID-19 infections in the country went down by 11% over the past week. But the OCTA research team says there's still no reason to be complacent. The Food and Drug Administration is set to investigate the distribution of Ivermectin in Quezon City after some health professionals pointed out what appeared to be illegal prescriptions. More women are expected to give birth in the second year of the pandemic. In line with this, experts warn against certain health risks. Hundreds of economic frontliners received COVID-19 shots in the symbolic Labor Day vaccination. And meet Singapore's representative to the Miss Universe competition, who was born and raised in the Philippines. Fast, focused, and fearless. Here's everything you need to know as you jumpstart your day. I'm Charles Lejano. Starting off today's newscast with the OCTA research team recording an 11% decline in new COVID-19 cases nationwide over the past 7 days. The Philippine Star reports that the OCTA saw the average new COVID-19 infections drop by more than 1,000 cases from the previous week. However, OCTA's Guido David says this should not yet be attributed to the enforcement of MECQ and the NCR Plus bubble since April 12th. David expects the MECQ's effect to be determined by next week, and he adds that fluctuations in the number of COVID-19 cases could be caused by late reporting or closure of certain testing centers. Local regulators are set to conduct a probe into the unauthorized distribution of Ivermectin that was held in Quezon City last week. This after health workers raised concerns about irregularities and so-called prescriptions that were provided during the event. Health Secretary Francisco Duque III reiterated that as of now, there is not enough evidence to show that Ivermectin can prevent or treat COVID-19. That's why the FDA only allows select hospitals and pharmacies with special permits to use the anti-parasitic drug.
So, kailangan yung pangalan, ano yung side effects, gaano katagal, ibinigay, ilang doses, ano yung beneficial effect, hindi lang side effects. So, marami dapat inire-report sa FDA as part of the pharmacovigilance of FDA. Kung kulang siya, then there is a violation. And PRC will look into this.
For their part, Health Undersecretary Maria Rosario Vergere also assured the public that they are ready to help those who received free Ivermectin capsules. Patients with Ivermectin are encouraged to coordinate with the Department of Health so that they could be properly monitored for possible side effects. However, Vergere emphasized that accountability lies with the patients and doctors who are willing to try the unregulated drug.
In the end, at the end of the day, it's going to be a decision between the patient and the doctor. Kung ang pasyente ay gusto talagang sumubok ng ganyang gamot, bagamat nagbibigay na tayo ng abiso, kung ang doktor din po ay gusto niya pong magbigay ng ganyang gamot, the accountability is theirs. Kailangan lang po talagang bantayan, and DOH is also monitoring.
The government held a symbolic Labor Day vaccination drive for Filipino workers over the weekend. JC Cosico with the details.
34-year-old overseas Filipino worker Kelvin Oyami works in a cargo company. In celebration of Labor Day, he joined hundreds of economic frontliners who received their COVID-19 shots in Quezon City. Kelvin is currently on vacation, but he will soon be leaving again for work.
I need to be safe. Kasi hindi naman to para lang sa akin actually, para sa pamilya ko. Dahil baka ito nga naman ang sagot sa problema na to. Kasi ang tagal na nito isang taon na.
Aside from OFWs, delivery riders and tricycle drivers were also inoculated in the city's drive-through vaccination center. Among them is Miko Ronquillo, who has been a tricycle driver for 3 years. He says the pandemic affected his earnings and he hopes the vaccination would help bring things back to normal.
Magpabako na lahat para makapagtrabaho na lahat para gumanda na yung natin ng ekonomiya. Gihirap na po
But Quezon City Mayor Joy Belmonte says the drive-through vaccination site will only be fully activated once inoculation of those under the A4 priority group begins.
Yung layunin yan ay mapabilis, no? Kasi syempre bumabiyahe ang mga toda natin. Kaya gusto namin mabilis sa madaanan na nila yung pagbabakuna. Hindi na nila hihintayin yung isa't kalahating oras, no, na nare-require.
Health Chief Francisco Duque III says the rollout of jabs for the A4 sector may start by the end of May or early June.
Ito po ay dumidepende pa rin sa sapat na bakuna na parating. Wala po doon sa atin na inaangkat ng gobyerno.
The government targets the inoculation of around 70% of the country's population to achieve herd immunity, and a chunk of this number is expected to come from the labor force.
Hindi lang siguro isang araw, kundi mas marami pang panahon ang iaalay ng ating pong gobyerno sa mga ibinubuwis ninyo na buhay, luha, dugo, para lang po makapag-ambag sa ating pong tinatawag na pagpapaunlad ng ating bayan.
For News 5, JC Cosico, we are One News.
Health experts are warning against the possible side effects of COVID-19 and its vaccines on pregnant women. This as more women are expected to give birth in the second year of the pandemic. Faith Del Mundo has the story.
It's not just COVID-19 infections that are on the rise, but also the number of expecting Filipino mothers. Health experts warn that if a pregnant mom is infected, they will be at risk for severe complications. While pregnant women are deemed not any more susceptible to COVID-19 than the rest of the population, health experts warn that the complications will be severe should they be infected with COVID-19. That is what Dr. Sibylis Ann Bravo, OB-GYN from the UP College of Medicine said in Laging Handa public briefing.
Ang mga buntis po, hindi naman sila mas madaling mahawa. Pareho lang po yung chance ang mahawa ng COVID infection ng mga buntis doon po sa non-pregnant population, including mga males po at mga bata. Yun nga lang po, according sa ating pagsusuri, as experience po namin, kapag ang buntis po ay nagkaroon ng COVID infection, yun nga lang po, maaari itong maging mas severe, mas grabe po ang consequences.
Possible complications include low birth weight or preterm or premature delivery. Bravo said there is also a small chance for the mother to pass the virus to the baby while in her womb.
Pag nagkaroon po ng infection ang nanay at siya ay buntis habang pinagdadala ang kanyang sanggol, may mga complications po katulad ng mas mataas po ang chance na siya ay manganak ng mas maaga, yung preterm delivery na tinatawag. May chance din po na baka mas maliit ang sanggol, no, kumpara sa mga babaeng hindi nagkaroon ng COVID. Yun po, at saka medyo may small chance po na baka sila ay mas CS kumpara sa mga buntis na walang COVID. Yun po yung mga complications na sinasabi natin. Added to that po, yung pag moderate to severe po, mas mataas ang chance na magkaroon sila ng more severe at critical state ng COVID infection pag sila po ay naging highly symptomatic.
To lessen exposure, Bravo advised that pregnant mothers should have limited face-to-face consultation with their healthcare providers, especially during the first trimester or the first 3 months of their pregnancy, and to only meet the doctor face-to-face towards the due date. Even then, she said it should be on appointment. She clarified that if the expecting mother has comorbidities, it will be a different scenario. After delivery, a mother who is COVID positive is still encouraged to breastfeed her baby. This is so she can pass antibodies to her child through the breast milk.
Ina-advocate pa rin natin ang early discharge, breastfeeding, at i-maintain pa rin pong hygienic practices, of course. So kung meron pong inuubo or may sintomas na isang tao sa bahay, tayo po'y lumayo na at dapat yung ating kasamang yun, household contact, ay magpa-test na at lumayo muna sa atin.
The doctor also reminds expecting mothers that an RT-PCR swab test is required if giving birth in the hospital. Since there is a limited data regarding COVID-19 vaccinations on pregnant women, expecting mothers should receive shots with precaution and only during the last trimester. But since there is a limited number of supplies, they are encouraged to be vaccinated after the delivery of the baby.
Magpabakuna na po agad. Safe po ang COVID vaccine sa mga breastfeeding or sa mga postpartum o yung mga kapapanganak na nanay. Safe po ito. Please have your vaccine right away. Ngayon po 2 weeks na lang po. Kung due na po kayo ng second shot, please line up na po for the second shot. Ngayon po kung kayo ay beyond na po ng second shot niyo, no, kunyari after 1 month, no, medyo lumagpas na kayo, anytime po, pwede na po kayo magpa-shot, basta at least 2 weeks na po kayo naka-recover at wala na pong simptomas.
For News 5, Faith Del Mundo, we are One News.
The impact of the global health crisis may be universal, but one think tank says its economic effects are harder on women due to their greater exposure to the hardest hit industries. Oxfam America's Mara Bollis tells us more on Bloomberg's Quick Take Charge.
We start today with a new report that really caught our attention here in the newsroom. It breaks down the data behind the pandemic's massive economic impact on women due to overrepresentation in industries hardest hit by the crisis. So women around the world lost at least $800 billion in income in 2020, according to estimates by Oxfam International. For reference, that's more than the combined GDP of 98 countries. Globally, women lost more than 64 million jobs last year, a 5% drop compared to the 3.9% loss for men. The report found that women were more likely than men to drop out of the workforce or reduce hours during the pandemic, largely due to care responsibilities. So joining us now to discuss this all is Mara Bollis, Associate Director of Women's Economic Rights, Gender, Justice, and Inclusion Hub for Oxfam America. Mara, thank you so much for joining us on this day when you guys have this report coming out. Talk to us first about this $800 billion figure and how your team got to it.
Well, you know, these are staggering numbers. I mean, can you imagine the equivalent of a combined GDP of 98 countries? And this is a conservative estimate. It doesn't even include the income of hundreds of millions of women who are working in informal employment. So if we were to have been able to capture all of that lost income as well, it just starts to scratch the surface of how much of this income crisis that women are facing around the world.
And Mara, continue.
No, please go ahead.
Oh, no, I was just going to ask, I imagine Oxfam has conducted this report before. How just drastic is this number compared to sort of previous years that you've taken a look at this?
You know, this is a unique year. It's a year like none other. And I think that the reason for that is the unique role that women play in our economies. So this is actually the first time that we've recorded this specific income loss, and it's because of the coronavirus pandemic. And what we saw in terms of, as you said, women's concentration in terms of affected industries, but really it's women's work on unpaid care. Women do 75% of the world's care work. And as President Biden said on Tuesday night during coronavirus, many women were forced to leave their jobs because they couldn't get the care that they needed for their children or an elderly parent or a sick family member. And we see that in the U.S. so starkly in terms of the unemployment increases, particularly for women of color. And so this is I think it's a year where we've made the invisible visible, right? Women have always been the shock absorbers of our economies, and this really needs to stop now. We need policies that support women's unique needs starting now.
Now to entertainment news, Singapore's bet for Miss Universe pageant reveals having Filipino roots. Miss Universe Singapore, Bernadette Belle said she was born and raised in the Philippines before moving to Singapore at 11 years old. Ong will be competing at the 69th Miss Universe competition to be held in Florida on May 17, Philippine time. She will be up against 73 other candidates, including Rabia Mateo, who will be representing the Philippines. Ong, a producer and a radio DJ, believes her multicultural roots give her an advantage in the pageant.
I actually came from the Philippines. I was born there and raised up until the time I was 11 years old. In between that, I was also living in Hong Kong for a year or two, and I was able to really appreciate different roots of me being Filipino, Chinese, but also being integrated into a very modernized yet traditional-centric community, which is what Singapore really is.
And that's how the day is shaping up to be. Join us later at 10 a.m. as we monitor the day's biggest stories from sunrise to sundown. You can also catch One News on Signal Play. Register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.